Welcome back to the fascinating world of cutting-edge health optimization and longevity. In the second segment, Dr. Jin Xiong She shared the causes of aging. Let's dive into today's episode, where we discuss the causes and symptoms of metabolic dysfunction.
25% of people in their 20s have a deficiency in an NAD in their blood, which if NAD is one of the most important molecules because it's involved in 500 different cellular processes, then 25% of people in their 20s are already starting with a deficit.
Yeah, I mean, in terms of NAD, common belief is young people have high levels of NAD because they have plenty of energy.
Yeah.
And our extensive research have shown that about a quarter of the young children or young adults are already deficient in NAD level.
Which affects the cellular senescence, affects oxidative stress, affects the chronic fatigue, chronic inflammation as well. It's central to all those pieces. But what's the fourth step, or fourth cause of aging and disease?
The first one that I'll probably emphasize is metabolic dysfunction.
Yeah.
It's not just type 2 diabetes. Diseases have root cause in metabolic function, including some neurological diseases. Even Alzheimer's disease is related to metabolic dysfunction.
Yeah.
We eat too much carbohydrates, eat too much unhealthy food, and our cells are not metabolizing the food as efficiently as it should. It causes a lot of problems.
In some of the books I've read, like Metabolical by Dr. Robert Lustig, and talks how much processed foods basically disrupt the metabolic dysfunction. And then the expression of metabolic dysfunction comes back to some other things, like you said, mental health issues, Parkinson's, Alzheimer's, depression can be metabolic dysfunction from Dr. Chris Palmer's book, Brain Energy. And then also the other aspect that we've talked about, just fatigue. If you're dragging energetically, then you might have metabolic dysfunction. Are there common symptoms that you have some metabolic dysfunction?
Well, the common symptoms is obesity and lack of energy and lack of sleep. I mean, all these are related to metabolic dysfunction.
And does that mean the mitochondria, since they're powerhouses of the cell, are they malfunctioning or not getting the energy they need or not working as efficiently as they should if you have metabolic dysfunction?
It's a balance of the food intake and the consumption and also how you are metabolizing the food. So when you are not properly consuming the food, they get stored in the fat, so you can get overweight and obesity issues, and also you can get a lot of oxidative stress. So that becomes a common theme for many different symptoms.
And then a root cause of metabolic dysfunction, is that often a deficiency in NAD, or is it deficiency in other stuff? Vitamin D, as we mentioned, or something else?
There are many different causes. NAD deficiency is definitely one of the top reasons. Insulin resistance, that's another big one, especially in type 2 diabetes patients. Insulin secretion is usually not dysfunctional. Some do,
sure,
but the cells don't respond to insulin properly. They are resistant to the insulin signaling. And insulin resistance not only important for type 1 diabetes, but is also found in many other disease conditions.
Yeah, gotcha. Big deal, especially in America.